Welcome to Vermontitude, a collaborative effort between Great Eastern Radio, the Brattleboro Reformer, and BCTV to bring you the stories behind the stories on the topics you want to learn more about. Because there's always more, so there'll always be Vermontitude. Hosted by me, Peter Fish Case. Welcome to Vermontitude. New episodes drop every Tuesday and can be found by going to Vermontitude.com, Reformer.com, Brattleboro.tv, and locally on Comcast Channel 1078. We come to you from our studios at the Innovation Box on Landmark Hill. I'm Peter Fish Case, and each week I cover the topics that are of concern to Windham County and the towns that reside within its borders. Joining us today is Chris Dougherty. He is the CEO of Brattleboro Memorial Hospital, and today we're going to be discussing the administration's Big Beautiful Bill and how it affects rural hospitals like BMH. Welcome.
Thank you, Peter, and congratulations on this great show and this great service to the community. We really appreciate it.
Well, thank you. I appreciate that. Let's get right into it. How has the Big Beautiful Bill affected BMH's reimbursement rates, Medicare, Medicaid, and private insurance? Are we seeing this yet?
Oh, I'm happy to say not yet,
Okay.
but the tsunami is coming.
All right.
So at this point in time, it really hasn't taken effect. The first effects will be felt minimally in calendar year 2026. And then it starts to get progressively harsh in 2027, but especially 2028 and 2029.
Okay. So what does that mean then? When you say particularly harsh, like what are the things that we're not looking forward to?
Well, for me, it's all about Medicaid eligibility. I find this cruel in that people will be dropped from Medicaid. Senator Sanders has estimated that it's about 45,000 Vermonters are going to lose their health insurance by about 2028. And that is devastating for a state that has 660,000 people in it. That's amazing to me that any bill, it just seems so contradictory to where the country has been going under the Affordable Care Act, where we've gotten more people health insurance than ever before in this country's history, and coming closer to believing and to fulfilling that healthcare is a right of being an American. Now we're moving 180 degrees in a different direction.
Yeah, it definitely seems cruel on so many levels. So have you, well, I guess I should refocus some of these questions and saying, do you think that BMH will have to cut or reduce any services, staffs, programs in response to these? Should this thing progress as written?
Great question. I believe this bill unto itself, no, but it's the compounding effect of other decisions that are made both at the state level and at the federal level. This bill itself, Medicaid for BMH, is about 15% of our income. And income in hospitals comes from a combination of volume and rate. The rate is what we get paid. The best payment comes from commercial insurance companies. The lowest payment comes from self-insured or uninsured. The next to lowest is Medicaid. So what's going to happen is the volume in Medicaid, our next to lowest payment, is going to decrease, and that's going to move to self-insured or uninsured, which is our lowest rate. So that volume will increase in our lowest rate, but the movement is going to come from our next to lowest rate. In the short term, and I want to emphasize the short term, we should be able to weather that storm as long as state policy and other federal policy also do not pile on to this milieu already.
Okay. All right. Well, there's a lot to unpack with this thing, and it's so I can't thank you enough for coming in and trying to explain how this will impact our small rural hospital, which we hold dear.
Absolutely. It's a treasure to this community.
Yeah, over 100 years,
121.
121. So, and so we want it around for another 121.
So do we.
Are there any administrative compliance burdens that will be imposed by this?
Great question. At this point in time, I hate to say the focus has really been on the financial implications and the access implications, which is of major concern. Will uninsured individuals in Vermont have the same access to high quality care, especially primary care and preventative care? Haven't spent a lot of time looking at, is there additional administrative burden associated with this? My assumption is there probably will be, because there's probably reporting that will need to be done that will actually create a higher level of administrative burden than we already do have.
All right, let's do this, and we'll hit this on a street level. Will there be additional, should this thing go through as discussed, as presented, will there be higher out-of-pocket costs for services when people come in to BMH?
Oh, definitely so. And that will happen in lots of different ways. The first way is that Medicaid traditionally has had no out-of-pocket costs associated with it. So now if you're no longer covered by Medicaid, you're going to have higher out-of-pocket costs because now you're going to be self-insured, and basically the whole bill is going to come to you as out-of-pocket. Fortunately, and a tremendous credit to the state of Vermont, we have very strong financial assistance plans, as is part of the state law. But that is a big issue. The other big issue is that the Affordable Care Act created the health insurance exchange, and that has been, hence the name Affordable Care Act, incredibly affordable to not just Vermonters, but all over the country, to people who don't qualify for Medicaid. This was the expansion component. Those rates are going to go way up, I think as early as 2027, and that's going to mean higher out-of-pocket costs right away. The other thing is I'm assuming that, this will create a higher cost of healthcare for everyone, which ultimately means higher out-of-pocket costs, higher deductibles. I'm assuming that that's going to happen for us all.
Right. Well, and that's never good. And especially, hearing you say, like, we here locally anyway, I think is, healthcare is a human right.
I believe that strongly, and I think this is going in the opposite direction.
Right. What would BMH, if you could, like to convey to our policymakers, both public and elected, to know about how this is going to impact the big beautiful bill is what we're talking about, and how it's going to impact BMH?
I think the biggest issue for BMH, and I think for Vermont as a whole, and even the country as a whole, is not looking at the short term only. In the short term, there's some window dressing that has been put into play, a $50 billion rural healthcare transformation payment that will be split up among states, et cetera. The issue is the long-term effect of not having people on health insurance. And to me, that long-term effect is going to be devastating. This means that people will probably choose not to go to primary care appointments, choose not to participate in preventative health care, and ultimately come down with chronic illnesses and will have a less healthy population, which I think is truly atrocious. We're striving to have a healthier population. The Affordable Care Act has put a lot of emphasis on preventative health care, chronic disease management. And that's been the beauty of the health exchange, is that more people have insurance and they participate in that. If that goes away, you're going to see people in a few years coming to emergency rooms at BMH and other hospitals across the state in worse conditions than they should be. And that is, I think, a failure of a healthcare system in its fullest. And I think we've got to find ways to make sure that that doesn't happen. And that's what we're doing at BMH. But unfortunately, it costs money to try and keep people healthy. And that's going to be very difficult to do.
Agreed. So there's, you'll have to help me sort of suss this out a little bit. Sorry, it's just a question I just thought of. I think there is some legal portion. If somebody comes into the emergency room, that you have to treat them regardless of insurance. I assume that will still be a thing that's in play.
Thank God, yes, because I think it's not only a legal imperative, which it is. It's called the EMTALA Act, but it's also a moral imperative. Quite honestly, I can tell you at Brattleboro Memorial Hospital, if God forbid that ever be taken away as a legal imperative, we would still see that as a moral imperative to us, that's what we're there for. We are there for the community, and if they show up at our doorstep, we're taking care of them no matter what. We never look to see, well, they're uninsured, so we can't take care of them. Our job is to care for everybody, and it always will be.
Right. And all this while still trying to dance around insurance billing and having an entire department dedicated to fighting with insurance companies around this kind of bill is just going to really sort of overcomplicate that. I
agree. Actually, probably the biggest challenge we have at times is dealing with Medicare Advantage, which across the nation has sort of a historically higher denial rate and administrative burden component for hospitals than other, like traditional Medicare products. So this bill actually supports Medicare Advantage growth, which has grown slower in our community than it has across the United States. But we live in the second oldest state in the United States, and Windham County is the oldest county in this state.
I was not aware of that.
So we are growing our aging population. We have a wonderful group out there, the Windham Aging Coalition, that is doing tremendous work and actually educating BMH on how we can help the elderly age in an age-friendly way. I just hope and we'll fight incredibly hard to make sure that none of this deteriorates any of that work.
Well, it's certainly an uphill battle. Not one that I envy for small rural hospitals that just sort of struggle. I think it's a good time to remind everybody that hospitals are not designated as for-profit organizations. They are nonprofit organizations. Give us a quick, the elevator speech as to what that means and how you have to operate.
Sure, absolutely. Well, it goes back to first that EMTALA, that we treat everybody that comes to us. And as a not-for-profit, what that means is we fully treat those patients, not just do an emergency assessment and then send them on their way like a for-profit hospital might. We take care of all their needs, whatever they may be, regardless of their ability to pay. We have a wonderful financial assistance program, but you'll see that our charity care is a higher proportion than others. We actually, it's odd, but as a not-for-profit, we do pay tax. We pay tax to the state. It's a provider tax. We pay $6.6 million to the state of Vermont each year. And that's one of the things that the One Big Beautiful Bill Act is also starting to address so right now we pay 6% of our net patient revenue. That's the maximum amount that you can pay as a hospital. The state also gets a federal match of whatever we pay and whatever any other hospital pays. The federal government is trying to limit their match. So right now, 6% is the maximum amount that a provider tax can be, 6% of your patient revenue. By 2034, it will be down to 3.5%. I hate to say, as a hospital, that sounds pretty good to us because that's about a $2.88 million savings to us. Mm-hmm. But that means almost $6 million just from BMH needs to be made up somewhere. Right. And that's coming out of the Medicaid program. And hopefully our state, and we trust our state, to come up with ways to mitigate the impact of that.
Okay. I appreciate that explanation. Chris, anything we're leaving out that we should that you want folks to know?
Well, I think the way we look at this at BMH is it's kind of fitting that we're in the month of August because the U.S. Open tennis will take place at the end of this month. And before any player walks onto center court, they walk underneath a sign, a quote by Billie Jean King, and it says, "Pressure is a privilege." I can tell you BMH is feeling pressure, but that is a privilege to us. That privilege is that we feel this pressure because we must mean something to this community, and we know we do. We're more than a hospital. We're a lifeline to this community. We care deeply about this community, and this community cares deeply about BMH. So while we feel the pressure, we are viewing it as a privilege. It is our privilege to serve this community, and whatever the pressure may be, we are going to be there to continue to serve this community.
Chris, I really appreciate that, and it seems like a good place to stop because, with all of this stuff swirling around, just to know that the people that are forced into a fight are standing up and fighting back is greatly appreciated on my behalf, and I'm sure from those watching and listening.
Well, and thank you, Peter, because we know that you're constantly fighting for what's good for this community, and please keep it up.
I will. Thank you, sir.
Thanks.